Well, thank you for staying with us as we get into that second leg of our conversation. It has to do with a vaccine mandate, whether or not we need it, and even effecting it in these times. Adam Senanu is convener for the Coalition for Public Health and Justice. He joins the conversation. Dr. Titus Bayuo is General Secretary of the GMA, the Ghana Medical Association. And we have Professor Alfred Yawson, Head Community Health with the University of Ghana Medical School. Gentlemen, thank you for joining the conversation.
Thank you very much for having us.
Thank you.
And the title is President, actually. We have
yes. In fact, the General Secretary, so we have Frank Sribo, and then there is you. Dr. Bay, you were saying President? Is that what you were saying?
No, I was the one saying President.
Okay. All right, because I know you are General Secretary. So thanks for the clarity there. Now, hitting the nail right on the head, we have a bit of a tricky situation. In other countries, vaccine mandates are being enforced. Let me start with you, Adam. In our context, we don't have a vaccine mandate per se, but there is some enforcement in terms of some public sector workers, even including medical workers or health sector workers. Why are you against that?
Well, first of all, there are the legal processes that ought to be followed if you want to do vaccine mandates. We have a peculiar situation where we've had some institutions put out instructions compelling their members to get vaccinated or restricting the movement of Ghanaians in and out of their facilities. We think that if you want to do that, follow the right processes. The president has not put in place, and it's the president who has the capacity to restrict the movement of Ghanaians. That hasn't happened. There's no executive instrument. The Minister for Health has a right to pass an EI supporting a vaccine mandate. That also hasn't happened. Now, the major issue is, especially, and it's interesting, it's public health practitioners, especially, who've been really upset about the infringement on their rights to choose whether they want to be vaccinated or not, and their rights to work, because sometimes their rights to work has been impinged on, and then the restrictions on their movement. And many people are not too excited about some of these new vaccines and the implications they have. And so it is a current context. And so in principle, no objections to vaccinations and vaccines in general. We just think that we should allow this to still be a choice of the individual. And the constituency that is most bothered about this are the health practitioners who've been insisting that we need to do something about this.
Right, and I think that feeds into exactly what the GMA in its recent release dated the 10th put out. Dr. Bayuo, so why do you feel that it is not time yet for us to have a vaccine mandate? We have the Public Health Act, and it spells categorically what we can and cannot do. Why not now?
All right, thank you very much. From the point of view of the GMA, we do not think that the making it compulsory or mandatory is the way to go. It may be counterproductive now. I think we want to emphasize on the fact that the vaccines are good. We encourage everybody to take the vaccines. They will be helpful. They are a game changer in this battle. But we want government not to make this mandatory at this moment. In terms of the law, they may have the right to do so, but we think it will be counterproductive. We've had a very roller coaster vaccine history as far as this COVID-19 vaccination is concerned. At some point, hesitancy was very high, and we did a campaign, and we brought down the hesitancy. Unfortunately, when we were willing to take these vaccines, we did not have them available in the country. At that point, the cases go down, we have the vaccines, and people are not willing to take them. We appreciate why government may want to do the mandatory vaccination so that people take it up. But we think it's not the best way to go now. It will just increase more hesitancy and will let people do unscrupulous things to evade the system. People are even procuring the cards to show that they've been vaccinated when they've not been vaccinated. And that has never helped us. As a country, we've had very successful vaccination campaigns, and none of these was mandatory. Our children are vaccinated in schools. We do not complain, but it's not mandatory. And so we would urge that let's continue the education. Let's get everybody vaccinated. but the attempt at making it mandatory, it's not the best way to go.
Aren't you reaching for both ends of the stick? In one breath, you say it is a good thing. In fact, per your statement, you state that the vaccines are efficacious and all of that. And in another breath, you are saying we shouldn't have a vaccine mandate. Is that not the way we can actually have everybody on board taking shots of these vaccines? I mean, is this not a bit contrary?
No, it isn't contrary at all. Where the vaccines are good, the GMA is not questioning the efficacy of the vaccines. We have seen that they are efficacious. Our data shows that these vaccines are useful. But mandatory vaccination will be counterproductive. If people have concerns, let's address those concerns. But making it mandatory means that people are going to be forced to take the jab. We all know our society. The very fact that something is compulsory means that somebody is willing to defy it. People will do whatever they can take to defy what is mandatory. Let the people see how good it is. Let them understand how useful it is. Let them voluntarily opt to have it. And we think that's the way to go. Like I mentioned, the Ministry of Health itself admits that when they brought this threat of mandatory vaccination, people were procuring our vaccine cards without taking the vaccination.
We seem to have a bit of a situation with Dr. Bayo, General Secretary of the GMA. We'll get him back, but let me quickly get to Professor Yorson. Do you side with the two earlier speakers on this bit of a vaccine mandate? Before you come in with your response, Dr. Bayo, can you hear me? If you're back, can you hear me, Dr. Bayo? All right. So I'll proceed with you, Professor Yorson, until we can get Dr. Bayo back. Do you subscribe to what they are suggesting? I mean, there's been a pushback in certain quarters. The most recent, the bit about Canada and the United States, that border and truck drivers for days on end, holding the economy to ransom on the back of a vaccine mandate. Do you subscribe to their thoughts that it could have more of a negative effect than a positive one?
Thank you for having us. I would like to put everything in perspective and in context. When you are dealing with pandemics and the situation is always fluid and dynamic, so you take decisions as you go along. And then looking at what happened December to January, February 2021, that is coming from 2020. And then looking at the trajectory of how the pandemic was behaving in the later part of 2021, getting into 2022. It was important for government in trying to manage the situation to put in stringent measures to ensure that we don't get into a severer fourth wave. So some of these measures were proposed, the mandatory vaccination, especially for critical workers and people at the front line. However, fortunately, as a country, we've seen that the expectations have not been what we were expecting, let me put it that way. And fortunately, the Omicron, even though has been very infectious, the rate of hospitalization, the rate of mortalities and all that are quite low. And currently the health system is quite capable of dealing and handling it. That is where I tend to side with my colleagues both, that you make rules and take measures depending on the situation. Now that we are easing, and I also support that, yes, it's not like somebody has won, somebody has lost. No, government wanted to do this to safeguard the safety and protect the citizenry. Now that things have changed, we can insist that, yes, we really do not need the mandate, but we will continue to encourage people to take the vaccine. Primary vaccination is key. It's not that vaccination is not important. As Dr. Bayo said. It is important. Evidence shows vaccination, and we cannot run away from that. It is making it mandatory and the legal implications, especially comparing it to the situation we have now when we are not in very critical circumstance and the health system is capable of managing it. I think we can go the way we are going now, encourage more health workers to get vaccinated, primary vaccination, and those who are inclined to take the boosters to have them. That is what I will also support. That it shouldn't be a win or lose situation. We make rules and we make a mandate depending on how the situation is. Now, if the situation so demands that we can go with encouraging people voluntarily to take the vaccine whilst we continue the public education and making sure people have access when they need to, I think that will be the way to.
Prof, why this, again, why this effort? Because there are many countries that have vaccine mandates, just like we are getting taught. I mean, for us, public sector workers and some of that. In Austria, in Ecuador, in Germany, in Indonesia, in Micronesia, it is all persons, by the way. In so many countries, Turkmenistan, Canada, Costa Rica, Croatia, we were talking about the Canadian situation. It is not new, and it is all aimed at safeguarding the population. Mind you, and you are fully aware, we're not in the best of places when it comes to getting the vaccines proper. Now we are fortunate to have booster shots and all of that. Why not maximize them in terms of getting everybody to compulsorily have the vaccine shot? I mean, take herd immunity out. Isn't that the safest way to go?
That should be, but we need to put it in perspective and see the consequences that may come as a result of this. As Dr. Taito said, we know our society, even when things are legal and mandatory, people go out flattening. And at the end of the day, you may have negative consequences. So we need to consider our situation. We can also talk about countries like the UK, where a lot of the restrictions are being relaxed. So we will not be alone in this. We have others who are also easing and not going the way others have gone. So we need to consider our peculiar situation, see where the pandemic currently is, how many cases we are getting severe, critically ill, and mortality. Compare with the consequences that may result. You don't already have a number or the adequate numbers of health workers to take care of the number of patients we see. And if we go by this mandate, helpful to get all health workers immunized. However, there should be a way where we can engage and that let people who really have reasons, medical and other reasons not to be vaccinated, can readily come forward and explain this to health administrators, health authorities in their facilities without necessarily cutting them out from providing the functions they need to provide. Same way with other frontline workers who are in this category. So as I said, we need to look at the situation and make rules adequately to safeguard the situation. We do not have to follow what others are doing because others are doing. We need to consider our situation. And I am confident that where we are now, the health system can manage the situation if we are able to continue educating the public, to continue to take the safety measures that have been put in. Mind you, vaccine is not the only measure we are using to fight this pandemic. So all the other measures are still important to be highlighted. And therefore, we need to encourage more people, especially with the primary vaccination, get as many people vaccinated as possible. But with the legal issues and all that coming in, I spoke on your station a few months ago and was quite in support of the mandatory vaccination. My position hasn't changed. It has now because of the situation we find ourselves. We don't have to use a sledgehammer to kill a fly when we don't need to, when we can use other measures. So that is why, and the point I'm coming from. This
right, point. Right. Let me bring in Adam once more. So where we find ourselves now, I mean, health workers, for example, are being required to take the vaccine shots, and there too, there's been a bit of conflict. Legally speaking, what would be the approach, I mean, from your end, from your organization, if the mandate is rolled out, or at least as it is, or it's tightened even further. What do you think the way forward is in that context?
Well, let me start off by saying that we are in very good company, and it's not very useful belaboring points that have already been dealt with. And both Dr. Titus Bayo and Professor Yosen have said that the context matters. And I think we all agree with that. It's an iterative process where at each point, the context determines what set of tools you use to address the issue. And I'm excited to hear them all align with that. That's the way to go. So the first thing is always the context. There are also the ethical considerations, right, from the WHO level, where it's always better to do education, let people arrive at the point where in their minds they understand that I have to do this because it is beneficial to myself. So the ethical considerations is another leg of this whole discussion. To the specific issue of what we will do, I mean, this morning we probably, our lawyers are probably laying before court to try and place the injunction. I'm quite sure that if the GHS responds appropriately, so there are about 14 institutions that have released instructions either limiting the restricting movement or insisting that you can't work or enter our space if not been vaccinated. We want these institutions to reconsider that. Actually, if the GHS reconsiders it, they probably will take care of all of this. And let's allow the education to continue. Vaccination is important. Let vaccinations continue, but allow the individuals to take these decisions based on our understanding of the benefits that will accrue to them or otherwise.
Dr. Bayo, are you with us now? I mean...
yeah, I can hear you.
Right. You were making a point right before your train of thought was truncated. If you'd like to wrap up on that before I go to the next question.
No, I think it's been amplified by Prof, which is that we think that people should be given the choice. And we have proven with very successful vaccination campaigns in this country for our children, for polio, for all the others.
We appear to have lost Dr. Bayo once more. Right.
That was not that. So the other, yeah.
Go on, Doc. Go on, Dr. Bayo.
Yeah,
go on.
So I was saying the use of the other measures in this fight, which we think these are helpful, and the vaccine should not be mandatory. Regional directors of the Ghana Health Service that have instituted virtually warnings asking that health workers who are not vaccinated should not report to work. And if they do not report to work, they are not validated, which means they are not going to be paid and they are being laid off technically. This is going to be counterproductive at this stage of this fight. And we think that the government has to withdraw that directive and then consider the suggestions we are making. Let's get the people to believe in the vaccine. Let's get everybody to volunteer to take it, but let's not make it mandatory at this moment.
Okay.
In context, it's not necessary.
Right. Let me just acknowledge, Dr. Bayo, I have a final top-up for you on that very point. But let me acknowledge that we've been joined by Professor John Japong, Vice Chancellor for the University for Health and Allied Sciences, who also has a different take on this matter. But Prof, thank you for joining the conversation.
Thank you for having me.
Great. Just hold your horses for me. Let me clarify this with Dr. Bayo. So you talk about this bit about we've not got there yet. Look at the circumstances. We've had so many waves of COVID-19. Our economy is feeling the effect. Our education has felt the effect and still is. And so many things, business and all of that. When are we going to get to the point, do you feel, when we would have the reason to have a mandate? When?
Okay, so there are specific thresholds laid down in the Public Health Act. I didn't want to go the legal way, but for us to compel everybody in the nation to line up and take a jab mandatorily to bring people out and give them a jab, the disease must be of a certain significance. It must be so terrible, which is what Prof was putting in context, that how many people are we getting on admission now? How many people are critically ill now? What is the situation? Have we assessed the burden of the disease in our society now? Currently, what is our case load? So have we reached that threshold where we think this disease is causing such a significant mortality and morbidity that we must compel everybody? That threshold must be met. The other threshold that must be met, which I don't really want to go into, we must have clear evidence that what we are providing is a solution and is the ultimate solution. The vaccine is helpful, but we all know that only the vaccine cannot do this battle for us. The fact that somebody gets the vaccine does not mean the person will not get the infection. It can protect them from dying from it, from getting critically ill. So we think it's a double-headed approach. Let me say multifaceted that we are using. And we should use all the facets and not emphasize only on the vaccine. We believe in the efficacy of the vaccine, but we think that the exigencies that will warrant a mass vaccination compulsory, everybody being brought up and given a jab, has not been met yet.
Right.
Thankfully, our system is coping better now. Most people walking around in the community have been exposed already, and some have even developed some sort of immunity to it. We need a lot of research to know what is the community prevalence of this condition. And then I would also emphasize on the fact that from the point of view of our infectious disease experts and vaccinologists, we have had very successful campaigns. Some of them 98% uptake rate of vaccination, 90% uptake rate of vaccination, and none of...
Right. Okay, so we get the thrust of what you're saying. Let me bring in Prof. Japon now. You've heard what your contemporaries are saying, from Adam Senano of the coalition to, Professor Yorson and Dr. Bayo of the Ghana Medical Association. But you disagree. Why?
Well, thank you very much for having me and gives me the opportunity to share my opinion on this. Well, I must say I'm a member of the Ghana Medical Association. So ordinarily, when the Ghana Medical Association issues a statement on our behalf, I shouldn't be saying anything to contest it. But I feel that we need to look at the whole issue carefully. Dr. Bayo and Professor Lawson have enumerated issues relating to when you give a vaccine mandate as far as the public health law is concerned. That is very true. However, I think we are missing one component of it. The fact that a couple of months ago, we were in such a big crisis that we're all thinking of having a vaccine mandate should not make us, and the fact that now the disease burden appears to have gone low does not necessarily mean that we should take our eyes off the ball. Because you see, if you follow the epidemiology of this pandemic, and again, let's bear in mind that it's a pandemic, and it's not just a localized infection. We should not take our eyes off the ball. The fact that the disease burden has gone down now, this is even the time for us to wrap up our vaccinations to achieve the so-called herd immunity that everybody has been talking about. Yes, a vaccine mandate has not been issued by law, and for which reason nobody can implement a vaccine mandate. But I think that to say that because the burden of disease has gone down now, considerations of a vaccine mandate to completely go out, for me, is completely non-epidemiological.
Right. Interesting perspective. Professor Yorson, I'll give you 30 seconds. That will be the final word for this conversation. How do you react to that statement from Professor Japon?
No, I believe that we can go on and still encourage people to vaccinate, especially the primary vaccination.
Right.
It is not that we are going to take our eyes off the ball. We still should ramp up the vaccination, but the legal component and others that may rather inhibit people who otherwise would have been vaccinated, we need to consider it carefully and still continue all the measures that we have used so far to get people to vaccinate and continue on that tangent. We don't need to unnecessarily rock the boat when we have passed through the turbulent times and now we are in a more stable time. We need to use all the measures at our disposal.
That is precisely my problem. We say we have gone
vaccinate as many people as possible. Not just the mandate. We know laws in Ghana which are flouted. NHIS is mandatory, but people are not having NHIS. So the fact that we push out the mandate, we need to ensure that this is considered and implemented.
Right. Thank you so much, gentlemen. Professor Yawson, Professor Japong, Dr. Begio, and Edem Senano, thank you for sharing your thoughts on this all-important matter. The conversation continues, of course, as we still grapple with this mandate. But did you know that the income of a young entrepreneur from some selected businesses is exempt from tax for 5 years? Any young entrepreneur engaged in manufacturing, information and communications, technology, agro-processing, energy production, waste processing, tourism and creative arts, horticulture and medicinal plants does not need to pay any income tax on these activities for their first 5 years of operation. Now, a young entrepreneur engaged in business that enjoys an initial 5-year concession benefits from different tax rates for an additional 5 years. So here's the breakdown. Accra and Tema, 15%. Other regional capitals outside the 3 northern regions, 12.5%. Outside other regional capitals, 10%. And the 3 northern regions, 5%. If you need further clarity, reach out to the GRA office, the Ghana Revenue Authority, and they will give you the information you need. My name is Benjamin Akako. Thank you for joining me on the AM show today. Let's do it again same time tomorrow. The news is up at 10 and at noon. Happy Valentine's Day.